Our lecture today is about psychopharmacology. And psychopharmacology is an ancient branch and very recent also. So since 1940s, patients who have a mental disorder have few treatment options. يعني بال40 حتى 1940 من القرن الماضي ما كان اكو علاجات للشخص الذي يصاب بالمرض النفسي. So at that time they may have received insulin shock therapy, electroconvulsive therapy without anesthesia, or barbiturate or narcotic sedation. يعني مجرد يهدؤونه بالناركوتيك او بالباربيتوريت او يعطوه انسولين يسوون هايبوغلايسيميا يصير عنده شوك. And they almost certainly were confined for the time of their illness to a secure institution. يزدون مصحات نفسية. And the revolution occurred at 1950. The treatment of psychiatric patients changed dramatically. Where the first antipsychotic drug, chlorpromazine, were discovered in French. And the mechanism by which biological therapies such as psychopharmacological agent and electroconvulsive therapy work is not completely clear and understood till this time. And studies suggest that these treatments work primarily by regulating abnormal concentration of synaptic neurotransmitter and that are believed to play a role in the production of psychiatric symptoms. مثل ما حكينا انه قبلها بالمحاضرات الكيمياء Behavioural neurochemistry انه اي disturbance بالنيوروترانسميتر cause mental disorder. So the drug, the treatment acting to correct these abnormalities in neurotransmitter. But it really is part of the truth. All the truth is not known yet. How do these drugs work? You can see a table, and in this table, the putative mode of action of psychopharmacological agent on psychiatric symptom. يعني الطريقة الافتراضية لعمل العلاج حسب الأعراض النفسية اللي هي psychiatric symptom. For example, psychosis. Drug act on treat psychosis called antipsychotics. This drug act by blocking postsynaptic dopamine 2 receptor and serotonin 2A receptor and inhibiting the hyperactivity of dopamine and serotonin. If you remember, we mentioned in the previous lecture that abnormality in dopamine and serotonin cause psychosis, and psychosis means there is hallucination and delusion and abnormal thought disorder. Depression, a treatment depression called antidepressant, and this drug thought to be act by down-regulating postsynaptic alpha-2 noradrenergic and serotonin receptor over a 3 to 6. We should keep in our mind that this drug, I mean antidepressant, take 3 to 6 weeks to act, to exert their therapeutic action. Need time. And serotonin concentration via inhibition of reuptake mechanism or blockage of monooxidase activity. So antidepressants act by inhibiting reuptake of the neurotransmitter or by blocking the monooxidase. Monooxidase will يسوي destruction للسيروتونين والنورادرينالين. While the reuptake is another mechanism to regain back the neurotransmitter to the original cell, if you remember. In mania, الهوس, treatment here lithium, which act by modifying the second messenger signal transduction. Lithium هو ion electrolyte nearly similar to sodium, and it acts by modifying second messenger inside the cell and also by stabilizing the neuronal membrane and augmenting the function of serotonin. Also, it corrects this synchronization in the circadian rhythm. فالميكانيزم اوف اكشن هي المسن يشتغل على السكند ماسنجر، يشتغل على الممبرين ستابلايزيشن، ويسوي augmentation للفانكشن اوف سيروتونين، يزيد السيروتونين and corrects this synchronization of circadian rhythm. الانكزايتي التريتمنت الدراج هو البنزودازبين usually, which activate the binding site on the GABA-A receptor, causing an influx of chloride leading to hyperpolarization of the neuronal membrane and decreasing neuronal firing. Anxiety, there is more firing of the neuron. There is abnormal function in the GABA neurotransmitter. The benzodiazepine regulate this abnormality. First, we'll start with antipsychotic agent. The antipsychotic agent was called neuroleptic or major tranquilizer, are used to treat psychotic symptoms associated with schizophrenia and other psychiatric and physical disorders. And they can also relieve symptoms such as anxiety, agitation, and resulting from medical and psychiatric conditions. So they use for treating the psychosis and to relieve symptom of anxiety, طبعا in dose, small dose, and agitation resulting from other long-acting injectable depot form such as haloperidol decanoate or flofenazine decanoate administered intramuscularly every 2 4 can be used to treat non-complying patient. المشكله اكو بعض المرضى بالسايكاتري اللي عندهم مثلا سايكوسيس ما يرضون ياخذون العلاج نون كومبلاين، دول نضطر نستخدم لهم انجكشن كل اسبوعين الى 4 اسابيع انتراماسكولار انجكشن ديبو انجكشن اللي هي سلو ريليز. And drug interaction can occur between antipsychotic and commonly used medications such as antihypertensive and anticholinergic, antidepressant, and central nervous system depressant, antacid nicotine, like any other drug. And antipsychotic classified as traditional or typical, atypical, يعني two type here. أما traditional تقليدية أو الatypical الغير نمطية الحديثة. And this classification هو depend on their neurological action and side effect profile. راح نشوفها انه هذا الكلاسيفيكيشن يعتمد على الاكشن وعلى السايد افكت. First we will discuss the traditional antipsychotics اللي شلون تشتغل. ناخذ فكره انه الهايبر اكتيفيتي اوف دوبامين in the mesolimbic tract is associated with production of positive psychotic symptom. اذا عندي هايبر اكتيفيتي بالدوبامين راح يسبب لي psychotic symptom. The traditional لازم هنا تشتغل agent act primarily by blocking central dopamine due to receptor. تسوي blocking بعد الدوبامين ما راح يشتغل، ما راح يسوي هذا disturbance. On both synaptic neurons, an action that is believed to inhibit the activity of dopamine along this tract. يا tract اللي هي mesolimbic tract. Although negative symptoms of schizophrenia, such as withdrawal, may improve with continued treatment, traditional antipsychotics are most effective against positive symptoms, such as hallucination and delusion. Symptom مال السايكوسيس أو مال الشيزوفرينيا قسمه negative and positive. البوزيتيف هي الهالوسينيشن والديليوجن، النيجاتيف هو السوشيال withdrawal. The conventional antipsychotic act mainly on the positive symptom. They have little effect on negative symptom like social withdrawal. you can see a table in which the traditional antipsychotic agents and their dose or therapeutic dose and their clinical uses in addition to the psychotic disorder. And primarily يستخدمون لعلاج السايكوسيس. For example, chlorpromazine therapeutic dose in psychosis from 100 to 800. Also, this drug can be used in addition to the psychosis for the treatment of nausea, vomiting, and hiccups. The thioridazine in a dose of 200 to 600 can be used also in addition to psychosis for depression with intense anxiety and agitation. Traditional hypotensive agent هسه هنا عندنا اللو بوتنسي هو الكلوروبرومازين. الهايبوتنسي هو الهالوبريدول والفلوفينازين والترايفلوبيرازين. الهالوبريدول ثيرابيوتيك دوز هو 2 to 20، الفلوفينازين 2 إلى 15، والترايفلوبيرازين 4 to 20. Used for psychosis secondary to organic syndrome, for Tourette disorder and Huntington disease. These are neurological disease. Available in long-acting decanoate form. يعني ممكن نسويهم على شكل injection. And available in long-acting decanoate form. Also, they can be used to non-psychotic and anxiety in a low dose for up to 12 weeks. Adverse effect. What are the adverse effects or the side effect of this drug? The side effect should be kept in our mind and should be classified into circulatory, endocrine, hematological, hepatic, dermatological, ophthalmic, anticholinergic, antihistamine, and neurological. فأما نقسمهم non-neurological and neurological أو كلهم سوا. السيركوليتري ممكن يسوون orthostatic hypotension، ممكن يسوون ECG abnormalities, prolongation of Q interval, P interval. الاندوكراين يزيدون prolactin level and this may cause gynecomastia, galactorrhea, and erectile dysfunction and decrease libido. Hematological side effect leukopenia, granulocytosis, and usually occur in the first 3 months of treatment. Hepatic طبعا rare هو jaundice and elevated liver enzyme. Dermatologic sensitivity, skin eruption, photosensitivity, and blue gray. Ophthalmic may cause irreversible retinal pigmentation with thioridazine or deposit in the lens. Anticholinergic هي peripherally dry mouth, constipation, urinary retention, and blurred vision. Centrally هو agitation with confusion or disorientation. Antihistamine اللي هو weight gain, sedation. The other group of side effect here is neurological واللي due to effect on the D2 receptor in the other areas of the brain other than mesolimbic area اللي تشمل السيدو باركنسونيزم اللي هو muscle rigidity, slowed movement, shuffling gait, resting gait, tremor, mask-like facial expression, cogwheel, and rolling of saliva. التريتمنت هنا هو اما نعطي انتيكولينرجيك او البنزوتروبين او بروبرانول احيانا امانتيدين بنزوديازيبين or reduce the dose of medication. عاده نعطي الانتيكولينرجيك in small dose. Akathisia, another neurological side effect اللي هي subjective feeling of motor restlessness and inability to remain still, pacing, rocking. يعني المريض ما يقدر يستقر يتحرك ما عنده استقرار. هي الأكاثيزيا usually develops within 1 to 6 weeks of treatment and التريتمنت هي اما الانتي هيستامين او نعطي البيتا بلوكر بروبرانول بنزودازيبين. Reducing the dose anticholinergic also may help patient affected with this condition. Acute dystonia اللي very common تصير ولا الكونفنشال typical antipsychotic اللي prolonged تعريفها prolonged muscular spasm of the neck يسموها torticollis or eyelid يسموها blepharospasm or pharynx glossopharyngeal dystonia of the eye choleogyrec crisis أو الجو tongue or all the body called opsonatones. فإذن هي dystonia muscular spasm. This acute dystonia usually develops within a few hours of treatment. More common in men under the age of 40. فإذن هي common بالمن less than 40. It should be kept in our mind that an anti-emetic drug, metoclopramide, may cause such side effect. البلاسيل يستخدموه as anti-emetic علاج التقيؤ. التريتمنت ايضا اما بنزودايزابين او انتي كولينرجيك وانتي هيستامين. النيوروليبتيك مالجنانت سيندروم انذر نيورولوجيكال هو رير لكن شويه توكسيك مالجنانت هاي فيفر الكرايتيريا مالته هاي فيفر سويتنج generalized rigidity and increased pulse rate dystoniopathy decreased gesturing agitation. Develops early in the treatment and more common in men less up to last up to 2 weeks. The mortality high تصل 20%. التريتمنت هي طبعا rehydration to treat dehydration, muscle relaxant, stopping the agent and giving dantrolene or muscle relaxant, maybe bromocriptine, dopaminergic agent, and another side effects called tardive dyskinesia. Tardive يعني تأتي متأخرة late. دي abnormal writhing movements of the tongue, face and body. حركات التوائية usually develops after at least 6 months of the treatment, more common in women. The treatment was substituting the agent by a typical, نحوله من الconventional إلى a typical antipsychotic agent. Also, we can use tetrabenazine for this. At this moment, we finish the first part of the psychopharmacology because there are 2 lectures in the same graph. And thank you for your listening.